Hey, so I've decided to do this update and possibly all future updates like this with a video instead of typing it out. I figured that it'd be easier on me and hopefully you, the viewer, to hear my thoughts and feelings and the facts um, with in my words with my voice instead of my words, but through typing and text, I guess, technically. I don't have a script or anything. I don't know what I'm going to talk about when. It's all improv. But I think it'll be okay. A little more natural that way. Um, I do have a little tiny outline, I guess, in my head, the mental one, so I can, I know, basically I know I'm going to tell you exactly what I have in my words. I'm going to give you a demonstration, show you what's up with my arm and face and everything, and I'm going to talk about the surgery and I guess whatever else comes to mind while I'm talking. Yes, so if you bear with me, this might be a long video. What I want to do is a video today, exactly 2 weeks from my surgery, the first part of my surgery, and then I want to do another video next Thursday, which would be 1 week. And then I'll probably type an update the night before. Um, that's my plan. I don't know if I'm going to stick with it. We'll see. But anyway, um, as you hopefully know, I'm Adam Waddell. Um, I have a venous angioma in my brain, in the motor control center, right off the brainstem. Unfortunately, I'm not a doctor, or I don't have all those really specific long, you know, 3,000 consonants and one vowel terms for the regions of the brain, the specific small ones like where my angioma is located. So the best I can give you is the motor control center right off the brainstem. Um, what a venous angioma is a clump of blood vessels that have come together and have sprouted their own little, even smaller blood vessels. And the blood vessels in your brain, or may not know. I didn't know until I had this. Are like the size of a single hair, as far as width and thickness, I guess, and everything. So it's tiny. It's basically minuscule, really, but it has such a huge effect on me and other people who have this. But basically, it all clumps together. It's like all mainly, a couple of main blood vessels coming together, and then they intertwine, and then, like I said, they have little other blood vessels sticking out of them. And it's described as a Medusa head if you see it on a CAT scan or an MRI. And it looks like a Medusa head, with the snakes coming out of the head and everything. Um, and like I said, mine's located in the center of my brain. Most people who have a venous angioma or a cavernous angioma, which are two sides of the same coin, the same thing but different names, whatever, get them on the outside of the brain, between the brain and the skull wall. I guess the membrane. And usually there are only side effects or whatever that damages that they get from those angiomas are headaches or migraines, and sometimes they can be, people are epileptic because of it, or are prone to seizures for some other reason because of the angioma. And mine is extremely rare, so rare in fact that I'm apparently the only person in recorded history, all recorded history, to have this condition where it is and affecting me the way it does. Um, I'm sure there's other people out there who have the same thing, but they are misdiagnosed, or they don't have the resources that I was lucky enough to have to find out exactly what's going on, which I'm hoping what I'm going through and what I'm going to go through will help prevent, misdiagnosis going on. People who are told they have Huntington's disease and don't have very long to live or whatever, and their body's cognitively deteriorating. They can't feed themselves anymore in a few years, or all that stuff. And then people who just can't get an answer. Hopefully, they're able to find out exactly what it is based on me. Um, so anyway, what this does to me, I know I've shown probably most of you what it does, and just little tests that my neurologist has done with me. Um, but I know there's a lot of you who haven't had a chance to see it, especially this bad. Um, I have not taken any Klonopin, which is the only medication that um, I've tried that helps me even remotely. It doesn't help me much, but it calms me down enough to where I can kind of control it. It slows my entire body down, but whatever. I haven't had any Klonopin in just about 6 hours now, and this is how bad it's affecting me. Okay, so a lot of people know about my thumbs up test. My right arm here, perfectly stable. I can do whatever. Left is uncontrollable. I can't. This isn't me making it happen. This is just the neurons and receptors and synapses and everything in my brain just firing at random times and not letting this go the way I want it to. And I'm getting frustrated with it, obviously. Another one is keeping my arms kind of level. I can't do that. It has a mind of its own. It's trying to hit me. Just showing you. I mean, I have the capacity to do it. It's just not on my left side. Touching my nose and touching the screen or your finger or whatever. I'm probably going to put my eyes, so if I start crying or something, you know what's going on. Okay. So, anyway, this is a moderate version of it right now. I've had it be extremely worse, and I've had it be a lot better. It just depends on the day and stress factors in my life and everything and what's going on. So anyway, the angioma is obviously on the right side of my brain because the left side of my body is affected. You know how that whole opposite thing in your brain works. It also, affects my arm, obviously. It also affects the left side of my face. I don't know if you'll notice, but I kind of will like that. Oh my. will twitch without really noticing or whatever. I have a twitch here, and if I get really stressed, my eye will start, twitching here, or I'll start blinking really rapidly. It's in my leg. I kind of wobble when I walk. Sometimes I have a straight up, full-on limp. Marching band's really difficult, which is a pain in the butt, of course, but we'll try to work through it. Whatever. Anyway, so that's, I guess, what I can show you as far as what's going on, and a demonstration of how I'm being affected by it. Yeah, I've seen about 4 neurologists. I've seen 3 neurosurgeons. I've seen a lot of doctors who couldn't figure out what it was and how it's affecting me and everything. I first started getting these symptoms in November of 2008, my first semester in college at ASU. And it's progressively gotten a lot worse. It started off where I just couldn't, hold a cup of water in my left hand. It was just random, slight twitch, whatever. I didn't think much of it. I'm type 1 diabetic, and so I thought it might have just been, low blood sugar or something. But it's increasingly got worse. I wasn't able to hold, my girlfriend's hand. I wasn't able to open the door. I couldn't grab a doorknob after 1 month of having this. and it's obviously gotten way worse since then. I've had this for 4 years, but the rate that it's going, it's deteriorating my movement abilities rapidly. I have officially clinically 3 different movement disorders. I have myoclonic movement disorder, I have dystonic movement disorder, and I have choreic movement disorder. Like I said, I don't really honestly know enough about each individual one to tell me exactly what's going on, but they're they're bad and they're difficult and a pain in the butt. Again, like I said, I've seen a lot of neurologists. My first neurologist actually said I had Huntington's disease, which was kind of scary. And then they did some tests and found out I didn't. And I'm not going to go into that and everything, but suffice it to say it was pretty dramatic and traumatic for me and my family and the few people who knew. So the first doctor, did an MRI and just happened to stumble upon the Medusa head. So he figured out it was a venous angioma. We went with that. I've seen another neurologist here in town in Jonesboro who was very anxious really to have me have surgery because he really thought surgery could do something. We just needed to find the right surgeon. In the meantime, he put me on medications I've tried, and none of them worked except for Klonopin. And Klonopin was mainly, like I said, just calmed me down enough to where I could control this. It's kind of hard to explain. And then he referred me to a neurosurgeon in Little Rock who I went and saw. And the neurosurgeon, looked at my MRIs and everything and basically flat out said he wouldn't touch me with a 10-foot pole because of the danger of a venous angioma, which I'll go into in a little bit. So we kept on the medication route for a long time and nothing really changed. And then my mother and I had a sit-down chat meeting one day. We just, decided that now, which now being almost a year ago, now, in October of 2011, would be the best time to really get to work on fixing this. So we both did research, checked. I'm a member of the Angioma Alliance website, and so I, asked people who they'd recommend as far as doctors, neurosurgeons, or neurologists for my issue. The big thing that came up with that was a lot of people said that they don't think I have venous angioma. They think it's a cavernous angioma, which they're basically the same thing. The only difference is, the only big difference, there's a lot of minute little things that I won't bore you with, but the big difference is cavernous angiomas are able to hemorrhage and start bleeding, and venous angiomas just don't. For whatever structural reason, they can't bleed out, I guess. And all the neurologists up to that point that I've seen were saying that the angioma bled out, and that was what was causing my issues. It bled out, and the nerve was affecting the nerve endings in the motor control center of my brain, and threw my left side out of whack and everything. But they weren't able to tell me if it were a cavernous angioma or not, or just, if it was just venous. They kept saying it was venous, but they kept saying it bled out. So it didn't add up. So it was really confusing for us. We didn't know what was going on, obviously. And so through our research, we found Dr. Assam Awad up at University of Chicago. And so we scheduled an appointment. Well, actually, my mom, who worked at a doctor's office as a scheduling nurse, I guess, contacted his office and let them know what was going on and sent referrals and all that stuff. And he's basically like Dr. House. Okay, it was him. He's a neurosurgeon, and he had a team of fellows who, like House's fellows, would go through cases and solve them. And mine was rare and unique, and so he was very interested in it. So we sent him the information, and he and his fellows looked at it and got back to my mother and said we want to see him very soon. And so we went up and in June, and he wanted some more testing done just to make sure of what it was. It was an option that could have been a venous angioma or a AVM, which is an arterial venous malformation, which could be surgically removed, but was really tricky and difficult and deadly to have in my brain. Whereas a venous angioma could not be surgically removed, but was stable because it couldn't bleed out. And so I had to have an angiogram, which is where they, insert the dye through a tube up your groin and up into your neck, and then they inject it into your brain and take pictures of the blood flow, which was a very painful but really cool procedure. I got to see everything on the screens and stuff. But through that, we found out that it was a venous angioma and wasn't an AVM, which was good and bad. It was good because I wasn't at a higher risk for stroke or hemorrhaging or any deadly things like that. But bad at the same time that it could not be surgically removed. I was going to deal with it for the rest of my life. And so he referred me, Dr. Waddell referred me to Dr. Tao Z, who is a movement disorder specialist under the subset of neurology at the University of Chicago as well. And so he has taken a great interest in my movement disorder and what's going on and everything. And that really means a lot to me and my mother and Morgan, my girlfriend, and everyone who's met him and has seen him, with me, because you can tell that he wants to help a lot. And I go and see him, and he'll do all these tests and everything, and record them because it's rare and they want to do a reportable case on it. And he'll just sit back and rub his face, and you can tell he's really thinking, trying to figure out a way to help me medicinally. But after my last visit to him, we tried a new, brand spanking new FDA-approved drug for choreic movements with people with Huntington's disease. It didn't do a thing for me. And so, he decided that maybe we should check on a surgical option. And so he did. He went to a neurosurgeons conference and presented my case to a bunch of doctors, and Dr. Warnke, I believe is his name, the surgeon at the University of Chicago. They're all there together. Checked over my case and decided that a deep brain stimulation would be the way to go. I think I filled you in on all the details from then to now, all the big ones. I mean, there's a lot of little things that happened and whatnots, but I won't bore you with that. Basically, deep brain stimulation, it's not really a new surgery or therapy. It's been approved for use in people with Parkinson's disease since 1997, I believe. And I also know in 2002 or 2003, they got FDA approval to use that for people with dystonia. So, I mean, movement disorders, I mean, come on. And so they want to try it with me. And they're all really confident that it will work. What it is, basically, is 2 sets of surgeries and a lot of doctor's visits. On October 18th, I'll have the first set of surgeries, or well, the first portion of surgeries done, I guess. And what they'll do is, well, shave my head first, so I'm gonna be bald. I don't know how I feel about that. What, whatever, hair grows back, I guess. But what they're gonna do is drill a burr hole. They're saying about this big, I guess, into my skull, probably around here, based on whatever research and blogs and everything that I've read that people who have had this had done. So it'll be up here. They're going to drill a hole and insert an electrode into my brain, reaching down into the I can't remember the exact name of it, but it's the center that controls movements and all that fun stuff. The issues I'm having. So basically, they'll insert that in there, make sure it's in the right spot. They have to keep it away from the angioma because the angioma is dangerous and bad stuff could happen if the angioma's messed with. And it'll be about a centimeter away from my angioma, which whenever he first told me that, I got scared because a centimeter is not much. But he's telling me that what they do is they use this tower and get precise measurements and everything of where exactly they need to go. And he said their machines can accurately pinpoint and find everything and get where it needs to go within less than a millimeter. And so I felt a lot better whenever he was saying that because, technically, if you want to look at it in closer terms, between way less than a millimeter and a centimeter might be like a couple of miles, I guess. So that's safer and put me a little more at ease with the whole idea. So anyway, they'll put the electrode in, and then they'll seal it off and just leave it. And that's the first step. They'll suture me out, whatever, and then exactly a week later, which would be the 25th, I believe, I go back and they do the second step, which is inserting a pacemaker-like device about the size of a stopwatch. Coaches have run into my clavicle, which the clavicle's here, so I guess it'd be around here. They'll insert that into my skin, and they'll run an insulated wire from an insertion point behind my ear, down my throat, and into my chest. And they'll connect the wire to the pacemaker battery pack. It's usually called a battery pack, so I'm going to call it that. Into the battery pack, and then connect the top part up here up to the electrode that's in the brain. And then I go home. Both these surgeries are only like one-day things. The brain one, I have to stay in ICU overnight so they can monitor me. Of course, it's brain surgery. And then I get to go home the next day, provided that nothing goes wrong or a miss or a rot or whatever. And then the chest part definitely will be like, I'm in, takes about an hour and a half. I'll wake up, they make sure I'm okay, and they send me home. So they're both really quick recovery times, I guess, surprisingly, considering what it is and everything. So 2 weeks after I had the chest portion done, I go back in so they could take the sutures out of my head, and then they turn on the device and program it. And what it does is it sends electrical signals from the battery pack pacemaker through the wire into the electrode in my brain, which sends out various electrical signals, volts or amps or whatever. If I remember right, there's 4 different types of signals they can send out and tons of different frequencies. So I think I read something about 30,000 different combinations of what they can use. But while they put the electrodes into my brain, they'll be testing some, so they know a much smaller combination of what would work with me and what wouldn't. So anyway, they'll activate the battery pack and then um, program it to prevent as much extraneous movement as possible. Um, Now, of course, it is a battery pack, so I'll have to go in and look to me between 3 and 5 years. Every 3 and 5 years, I have to go in so they can take the old one out and put a new one in, which I'm not much looking forward to, but, you know, you do what you got to do, right? Um, and in Parkinson's patients who have more advanced stages, the deep brain stimulation, or DBS, as you might hear me call it, um, effectively removes 50 to 75% of all the extraneous movements. I don't have Parkinson's. I do have a degenerative movement disorder, 3 of them, and an angioma that's causing it. But I feel like I have a better chance of more movements being stopped, which is a huge deal to me. And I'll go into that in a minute. So anyway, the entire process will take about a month to get from where they first start drilling in my head to results from the DBS. 1 week and so a month, 3 weeks, close enough, whatever. So hopefully that'll be the ticket to taking care of me. They'll send me home with a remote to turn it on or off, or check the battery life in it. So it'll be pretty cool. Of course, there are risks with it being brain surgery, and then poking something into my brain, and even with the chest portion, there's like I said, just brain surgery risks. And so it's not anything that people don't know about. I guess you can look up the stuff yourself, because I really don't want to talk about it, honestly. I'm type 1 diabetic, which makes me much more prone to infections and the complications from infections. So the surgery here, I'm at a greater risk for an infection. But from what most of the stuff that I read, the risk of infection to non-diabetics is 3 to 5%. And so I don't honestly think my diabetes, which is in better shape than it's been for a long time, I don't think it's going to increase the risk too much. And my age is also on the side. I'm only 22. So it's not like I'm an older individual with diabetes and all these other complications. So it's risky, and I'm scared to death, honestly. Their Facebook status, and I said that on a scale of 1 to 10, I'm about 9 of being nervous, but 10 being excited. But I'm really excited about this, and I'm really looking forward to what it can do for me. And again, that's not saying that I'm not scared, because I am, and I do get the heebie-jeebies or the shivers or whatever whenever I think about what all they're going to do and how they're going to do it, and having to live with this device in here and this wire just coiling up my head, like my insulin pump, and also being bald. But it's a lot to take in, and a lot to process and think about. I mean, I kind of freaked out a little bit whenever I first got my insulin pump, and I had this thing permanently attached, well, basically permanently attached to my stomach. I just switched sides every 3 days. It freaked me out having that, and kind of hit home a little bit as far as like mortality or just stuff like that. And so this is, I know, it's definitely gonna hit me pretty hard. But if it improves my quality of life, then I don't think I'll have much of an issue with it. So now I get to talk about how these movement issues have affected me and stuff. I've had I have talked to people about this whole brain surgery thing, and there's a fair amount of people who ask why I'm even having the brain surgery. They say they don't think that it's worth it and everything. But then there's just, I mean, I don't want to be a critical kind of person or anything, especially whenever it comes to this, because it's unbelievably rare to have this. I'm the only one. And so the issue is people don't realize what it's like. Um, you know, if people would ask me what it's like to have the chorea and the myoclonic movements and the dystonic movements and well, just everything, you know, I used to think that I'd tell them, well, just imagine, you know, you not having an arm, or just try to go through an entire day without using your left arm at all. I was very lucky and very blessed in the fact that it did not affect my right arm or hand or anything, and that's my dominant hand. But you use your non-dominant hand for so much stuff. It's ridiculous. And so I think, I mean, acting like you don't have an arm or thinking that it's been amputated or whatever isn't really a fair representation of what I go through and what it's like. Um, it's more like imagining that, I mean, you have the arm, you just can't use it the way you want to. Um, and that was me. I've had this for almost exactly 4 years now, and my mind still tells me that I can open a door with my left hand, or hold a glass, or a plate, or a pencil, or grab a pen off my desk with my left hand. The fact is, I can't. I, I, I can't. I don't have the fine motor control movement in this hand. I mean, obviously, I, I don't have control over like the fingers and everything, and literally, it takes me a good 15 to 20 seconds to summon up enough mental control or calmness or whatever just to grab a doorknob, much less turn it the way I need to open said door. I cannot grab a pen or a pencil off a table or a desk or anything without, you know, risking injury to myself or people around me. I, I can't carry two things at once. It's all one at a time, so I make a lot of trips if I'm carrying multiple things. Um, I can't carry heavy things because this is significantly weaker than my good arm. I can't. I'm a musician, okay? I play trombone. I was lucky in that fact too because the left arm holds the trombone still, but the right arm plays it, and so it's difficult. But I can manage to play trombone fairly well. But I used to play piano. I, I can't play piano anymore, and that was extremely hard. Sitting down at my piano one day after I, started getting these symptoms and not being able to do the left hand. And that was insanely just like painful. I can't play bass guitar anymore. I have a bass guitar, and I'll sit down and pick at it every once in a while, but I can't really play a bass guitar anywhere like I used to or anywhere decently good. I don't have the capacity or the ability to hold down a string for long enough to really do stuff, and I can't move as quickly as I need to for other stuff. I mean, it's a lot more difficult than most people realize. And I can't really explain how it is. Um, and, I understand that some people just can't comprehend. And I understand that people just don't see the risk versus the reward. But I don't, I don't really, I don't really know. It's hard. And you know, there's a lot more that's been affected. I can't hold Morgan's hand with my left hand because whenever I do, I twist hers up or hurt myself or her. I can't really play with my youngest siblings because you know I can pick them up kind of, but not for long. And I can't, like I said, I can't really play with them. I can't run anymore, which is a big thing because I mean something as simple as running. I can't do it anymore, and so I can't chase them around the playground or anything. And it's hard to tie my shoes and buttoning my pants or buckling my belt takes just immense amounts of concentration and just thinking and frustration, and that's a big factor in all of this, like extreme frustration. And a lot of people, I think, the people who don't realize what it's like, which I realize nobody knows what it's like. Just like I don't understand what you're going through, whatever you have to deal with. But, I mean, a lot of people just kind of ignore it, which is okay. I don't want to be center of attention or be focused on or anything, but I don't think it's something that needs to be ignored. I like whenever people ask me questions about it, and I like when people show legitimate concern about the brain surgery and everything, because, like I said, I'm scared to death, and it's okay if, you tell me you are too. I understand. I mean, if one of you guys were having brain surgery or something, I'd be freaked out for you too. Um, but I don't know. It's just hard. Um, and like I said earlier, I'm really hoping that I'm able to help more people with this, turning the negative into a positive and everything. Um, you know, that's what I want to do. I want to help people. I want to raise awareness and everything, and I want to do stuff. And so, I mean, I'm thinking about starting up like an actual official blog and everything. And I'm gonna try to do things for this and people who have other people who have movement disorders, and I'm gonna try to somehow advocate, deep brain stimulation for different things, because if it works for me, it's gonna work for other people. That I'm gonna do whatever I can to help other people, because that's extremely important to me. I might be the only reported case of this, but there's no telling how many other people in the world don't know that they do have this. So, yeah. Um, I guess that's really about it. Um, um, yeah. So I'm going to leave it at that, and I'm going to upload this to YouTube, where you're watching it right now. Magic. And then I'll put it in a note or something, and people will be notified of it and watch it, hopefully. So anyway, yeah, that's it for now. I'll do another one of these in a week whenever we're closer to surgery, so we can see if I'm any more frazzled or weirded out or scared or excited or anything, which I'm sure I will be. So, but anyway, it was nice having this talk with you. Hopefully more people understand and have a grasp of what's going on. And hopefully these past 40 minutes haven't been miserable or anything. I'll talk to you guys soon. Thank you.